Hey everyone, this is Jet here from Clinical Research and Tea with Jet. In the past few weeks, we've been going over this health series about how to stay healthy. And this week we are covering women's health. In this episode, I wanted to cover something that affects 1 in 8 women. That's breast cancer. Well, what is breast cancer? Most of us know what breast cancer is. It is cancer that occurs when malignant tumors form in breast tissue from cancer cells. These cells can break away, enter lymphs or blood vessels, and spread, causing metastasis. Now, mostly women are subjected to this specific cancer. However, it is not unseen by men. It's just a little bit more common for women, unfortunately. Now, early detection dramatically improves outcomes. When breast cancer is found in a localized stage, the 5-year survival rate is nearly 99%. There are 3 key ways to detect breast cancer early. You can perform a breast self-exam once a month to become familiar with how your breasts normally look and feel. While this practice isn't proven to reduce mortality, it helps you to recognize changes quickly and report them to your healthcare provider. Usually while you're showering is an easy way to perform this. And if you're unfamiliar with the technique, please talk to your OBGYN or primary care provider and they can show you the proper way to do it. And speaking of your OBGYN or your primary care doctor, a trained health professional can often detect suspicious areas that may not register during a self-exam. These exams are a vital part of routine screening and can catch abnormalities early. So they can also do the breast exam for you, and a lot of times still automatically do it during your yearly pap smears. For women at average risk, the U.S. Preventative Services Task Force now recommends starting mammograms at age 40 and repeating every 2 years through age 74. Major organizations, including the American Cancer Society and American College of Radiology, recommends annual mammograms from age 40 to 54 with the option to transition to biennial screening at 55 years or more. Women at high risk, such as those with the BRCA1 or 2 mutations or a strong family history, may benefit from annual mammograms plus breast MRI starting as early as age 30. As of September 2024, mammogram reports must include notification of breast density. Mammography has proven effective in detecting cancer in dense breast tissue with detection rates comparable to MRI. I'm not sure if it's recommended, but you can also ask for an ultrasound if you know you have dense breast tissue. It has been seen to be more effective than mammograms in some women. But please ask your doctor for this advice. Schedule mammograms once to 2 weeks after your period ends to avoid breast tenderness. If you do get really tender breast, I definitely recommend to wait. There's no point in putting yourself through that type of pain unnecessarily. Most procedures are quick and only mildly uncomfortable. Now that's also, depending on who you ask and your pain tolerance. If screening shows something suspicious, additional imaging like diagnostic mammograms or ultrasound is used to locate it. A needle biopsy confirms diagnosis in about 10 to 20% of cases, while most biopsies are benign. Conditions like fibrostic chains are staged using the AJCC TNM system, which considers tumor size, lymph node involvement, and metastasis. Staging guides prognosis and treatment planning. Early stages 1 through 2 often mean localized disease. Stages 3 is locally advanced, and stage 4 refers to metastatic spread. There are many types. Most common is ductal carcinoma, which is approximately 85% of women. followed by lobular carcinoma with only 10%, and rarer subtypes such as tuberculosis, medullary, or inflammatory breast cancer. Subtyping matters for treatment. Nearly 80% of breast cancer are hormone receptor positive, which is the ER plus, PR plus, which is the estrogen or the progesterone, treated with hormone therapy. Around 15 to 20% overexpress HER2 or HER2, which is targeted with specific therapies. Another 15 to 20% are triple negative, lacking ER, PR, and HER2 receptors, often occurring in younger and BRCA positive patients and more challenging to treat. Treatment depends on subtype and stage and typically includes surgery such as lumpectomy or mastectomy, plus lymph node removal and possible reconstruction. Radiation therapy to reduce local occurrence, chemotherapy, especially for triple negative or advanced cancers, hormone therapy for ER, PR positive cancers, targeted therapies like anti-HER2 drugs. Patients may also manage side effects through wellness, nutrition, and physical activity. I want to talk about some of the breast cancer myths, some common myths and facts behind them. So, myth number 1, breast injuries cause cancer. The fact is, injuries do not cause cancer, although they can reveal an existing issue. Myth number 2, only older women get breast cancer. Fact, while more common in women over 50, younger women are increasingly diagnosed, often with aggressive tumors. Myth number 3, sugar causes breast cancer. The fact is, sugar doesn't cause cancer directly, though poor diet and obesity can raise risk. Myth number 4, all breast cancers are treated the same. Now, the fact is, treatment is tailored based on subtype, stage, and patient preferences. Myth number 5, breast cancer always presents as a lump. Some cancers, like lobular or inflammatory types, may appear with no lump. Symptoms include skin dimpling, discharge, or redness. Now, on a more personal note, I was diagnosed with breast cancer at the age of 40 while I was 7 months pregnant with my first son. Now, one of the myths for that is most people understand that if you're pregnant, you can't get breast cancer. While there's some truth to it, they say that breastfeeding your child can reduce the risk, but it is not impossible to get breast cancer, as I am the evidence for that. Now, my breast cancer was also due to the fact that I had a mutation which is called the CHEK2 genetic mutation. That is a lesser known mutation. I didn't know that I had it until I was diagnosed with breast cancer. I did find it myself. It started as a lump in my breast and then progressed to a lump in my armpit, which was my lymph node was inflamed. Now, I'm not saying that if you feel lumps while you're pregnant that it's going to be breast cancer. Most of the time it's just going to be the development of your mammograms preparing for breast milk. But if you do have a history and you have concerns, just talk to your doctor about it. They're not going to look at you ridiculously. I mean, you ask them to check it out and it turns out to be not cancer. Well, I mean, you could sleep better at the end of the night. There's nothing wrong with that. If you want to know more about my breast cancer and have questions, please leave me a comment below and we can definitely talk about it. I would love to be able to have these conversations with you all. So while breast cancer is complex and not a one-size-fits-all cancer, early detection saves lives, personalized treatment is key, and myth-busting empowers better decisions. If you're watching this and haven't talked to your doctor about screening or noticed any changes, please don't wait. I didn't wait, and because I didn't wait, sorry y'all, my son gets to have his mother. Please be adamant and be persistent. I went to my doctor with my lump, and he, just told me, don't worry, it's probably just growth from your breast changing, preparing for your son. And like I said, I found the lymph node, and I went back and told him that I was still concerned, and he didn't make me feel stupid at all. And we were able to find it early enough so that we could get rid of all the cancer, and I'm still here with you all today. So please do not hesitate to talk to your doctor, no matter how ridiculous you feel. If your doctor does make you feel ridiculous, well, then I would report them, because there's nothing ridiculous about making sure that you stay safe and healthy. Anyways, enough of that tears, because we're celebrating the fact that I am breast cancer free. And I'd love to celebrate with the rest of y'all that are out there, my fellow warriors and survivors. So thanks for watching Clinical Research and Tea with Jet. Please like, comment, and subscribe for more health insight, and share this video if you found it helpful. Thanks all. Please have a cup of tea with me.